The Uganda population-based HIV impact survey was carried out from 2020 to 2021, 5 years after the previous one was conducted in 2016. The survey that was carried out in 11,130 households had a sample size of 15,801 women and 11,834 men aged 15 years and older across all the districts of Uganda. The survey shows a decline of 0.5% from the previous survey that was last conducted in 2016, that was 6.0%.
In the entire UFIA 2020 survey, samples of adults aged 15 years and older, HIV prevalence was 5.8%, 7.2% among women and 4.3% among men, corresponding to approximately 1.3 million adults living with HIV in Uganda. The prevalence of HIV in adults 15 years and above was higher in urban areas at 7.1% than in rural areas at 5.2%.
Because as you know, in the past we were having rising HIV prevalence in the early 80s, in the early 90s, around 90s, and in 2000, when we stagnated around between 6 and 6.5%. We shot up a little bit in 2004, 7.3%, came back down in 2016 to 6%, and now you can see 5.5%, which is indicating that the number, the HIV prevalence, is actually not shooting out of range as it was doing in the earlier years. And this is expected because we have, as a program, as a country, succeeded in identifying a significant number of the HIV positive individuals and put them on treatment.
The survey further indicates that HIV remains high among women compared to men. The prevalence among women is 7.1%, while among men is 3.8%.
Among men, HIV prevalence was highest in the 45 to 49 year age group at 11.1%, and among women, HIV prevalence was highest in the 50 to 54 year age group at 13.6%. The survey reported continued higher HIV prevalence in young women than in young men. The HIV prevalence among young people aged 15 to 24 years was 1.8%.
Greater Masaka remains the highest sub-region with the HIV prevalence at 8.1%. Acholi and the Lango sub-region registered the second highest HIV prevalence at 7.6%. Chigezi sub-region is the third highest in HIV prevalence at 6.3%. Greater Luero is the fourth at 6.2%, Kampala at 6.0%, Bunyoro at 5.5%, Busoga at 4.5%, Teso sub-region at 4.2%, Bugisu sub-region 4.2%. West Nile sub-region registered 2.8%, while Karamoja 2.1%, the lowest in the survey. The reduction in HIV-AIDS prevalence is attributed to the number of factors, including safe male circumcision and uptake in taking medication.
That circumcision is a very important intervention in HIV prevention among men. We have clear data which came through other sources. In Uganda here, there was a randomized control trial in Rakai, which was done by a team from the Rakai Health Sciences Program. There was another study in Kenya, in Western Kenya, and another one in the Orange Farm in South Africa, which demonstrated that circumcision protects young men from acquiring HIV to a level of up to 50 to 60%. So the data are strong, and based on that data, we are actually implementing this program. And as you can see, we're expanding. And we know that, yes, there are some geographical areas where there may be discrepancy between the coverage of circumcision and the HIV incidence and also HIV prevalence and other outcomes. But there could also be other protective factors in those regions. So it's not a single factor. It is a combination of different HIV prevention, HIV care and treatment interventions that will give you the total picture of the impact both in terms of HIV incidence and HIV prevalence, rather than one single factor, whether it is circumcision or other intervention that we may want to talk about. So,
the survey, financed by the US government, is done every 5 years to assess the impact of HIV on the communities and helps policymakers in planning.
With regard to U.S. investment in partnership with Uganda, as I mentioned, since 2003, we've invested over $4 billion in PEPFAR. And as we look at our other activities, in 2020, the sum total of U.S. investment in Uganda was $953 million.
Philip Aguta, UBC News.